There's something uniquely terrifying about hospitals at night. The fluorescent lights hum with an electric buzz that never quite fades into the background. The hallways stretch longer than they should, and every footstep echoes like a warning. But for most people, hospitals represent hope, a place where trained professionals work around the clock to save lives, to fight death with every tool at their disposal. Parents trust these institutions with their most precious gifts, their children. They place their faith in the hands of nurses and doctors, believing that when they leave their sick baby's bedside to get some rest, those caring hands will continue the vigil. They believe their child is safe. But what happens when those caring hands belong to someone who doesn't want to save lives? What happens when the person you trust most, the one wearing the uniform and speaking in soothing tones, is actually the one you should fear? What happens when the angel of mercy is really an angel of death? April 22, 1991. Grantham and Kesteven General Hospital in Lincolnshire, England. Children's Ward 4. It was supposed to be a quiet shift, the kind where nurses could catch up on paperwork and parents could finally get some rest knowing their little ones were stable and healing. 15-month-old Claire Peck had been admitted earlier that day with a chest infection. She was asthmatic, and her parents were understandably worried, but the medical staff assured them she would be fine. She just needed a little help breathing, some monitoring, and she'd be home in no time. Beverley Allitt, a state-enrolled nurse who had been working on Ward 4 for just a few months, took a special interest in baby Claire. She reassured the parents with that calm, professional voice that nurses perfect over years of practice. She told them Claire was in good hands. They could go home, get some rest, and she would personally make sure their baby girl was looked after. The parents reluctantly agreed. They had no reason not to trust her. She seemed so caring, so attentive. She even volunteered to watch over Claire personally. Less than an hour after the parents left, alarms started blaring through Ward 4. Claire Peck had gone into cardiac arrest. The resuscitation team came running, their feet pounding against the linoleum floors. They worked on the tiny girl with desperate efficiency, performing chest compressions on a body so small that 2 thumbs were enough to cover her entire chest. Against all odds, they brought her back. Her heart started beating again. Color returned to her face. It was a miracle, the kind that makes you believe in the resilience of the human spirit, especially in children. Beverley Allitt stayed close throughout the entire ordeal. She seemed shaken, emotional even. She kept checking Claire's vitals, adjusting her blankets, hovering near her incubator. The other nurses noticed but didn't think much of it. Allitt was known for being attentive, maybe a little too attentive, but that wasn't necessarily a bad thing in a nurse, was it? The resuscitation team dispersed once Claire was stable. The crisis had passed, or so they thought. Beverley Allitt was left alone with Claire Peck for just a few minutes. Just a few minutes was all she needed. The alarms went off again, screaming through the ward with renewed urgency. The team rushed back, but this time there was nothing they could do. Claire's little heart had stopped, and no amount of chest compressions or emergency interventions could bring her back. She was gone. Dr. Nelson Porter, a consultant at the hospital, stood in the hallway outside Ward 4 that night with a feeling he couldn't quite name. It wasn't grief, though he certainly felt that too. It was something else, something darker, suspicion. You see, Claire Peck wasn't the first child to die suddenly and unexpectedly on Ward 4. In fact, over the previous 2 months, there had been an alarming number of cardiac arrests, unexplained collapses, and mysterious deaths. The numbers didn't add up. This was a small children's ward in a relatively quiet hospital. These kinds of incidents were rare, maybe 1 or 2 a year if that. But in just 59 days, there had been 25 separate suspicious episodes involving 13 different children. 4 of those children were dead. Dr. Porter knew something was terribly, terribly wrong. And when he started looking at the shift patterns, when he started asking questions about who was on duty during each of these incidents, one name kept appearing over and over again: Beverley Allitt. She had been present for every single suspicious episode, every cardiac arrest, every unexplained collapse, every death, every single one. The investigation that followed would reveal one of the most horrifying cases of medical serial killing in British history. Beverley Allitt, the young nurse who seemed so dedicated to her job, who volunteered for extra shifts and reassured worried parents, had been systematically attacking the children in her care. She injected them with massive doses of insulin. She administered lethal amounts of potassium. She injected air bubbles into their bloodstreams. She suffocated them. She tampered with their oxygen supplies. And she did it all while wearing a smile and a nurse's uniform. But this story doesn't start on April 22, 1991. It doesn't even start when Beverley Allitt first walked through the doors of Grantham Hospital. To understand how someone could do something so unthinkably evil, we have to go back further. We have to understand who Beverley Allitt was before she became the Angel of Death. Beverley Gale Allitt was born on October 4, 1968, in the small village of Corby Glen, near Grantham in Lincolnshire. She grew up in a working-class family with 2 sisters and a brother. Her father, Richard, worked in an off-license, and her mother was a school cleaner. By all outward appearances, it was a normal, unremarkable childhood. But those who knew Beverley as a young girl remember things that, in hindsight, seem like warning signs written in invisible ink. From a very young age, Beverley was obsessed with getting attention, particularly through illness and injury. She would show up to school wearing bandages and casts, claiming she had hurt herself in various accidents. But here's the strange part: she would never let anyone actually examine the injuries. If a teacher or school nurse tried to look under the bandage to assess the wound, Beverley would become agitated and refuse. It was as if the performance of being injured was more important than the injury itself. As she grew older, the attention-seeking behavior intensified. She became overweight as an adolescent and increasingly aggressive toward others. She spent an enormous amount of time visiting doctors and hospitals, complaining of various physical ailments. The list of her supposed medical problems grew longer and longer, a revolving door of symptoms that never quite added up. Medical professionals started to notice a pattern. Her complaints were often vague, her symptoms inconsistent, and she seemed almost disappointed when doctors told her nothing was wrong. The culmination of this behavior came when Beverley insisted she needed her appendix removed. Doctors examined her and found absolutely nothing wrong with her appendix. It was perfectly healthy, but Beverley was so insistent, so convincing in her complaints of abdominal pain, that eventually a surgeon agreed to remove it. The surgery went fine, but the recovery didn't. The surgical scar should have healed normally within a couple of weeks, but Beverley's scar kept getting infected, kept reopening, kept causing problems. The doctors were baffled until they realized what was happening. Beverley was interfering with the wound herself. She was picking at it, preventing it from healing, all to prolong her time as a patient, to keep the attention focused on her. This behavior has a name. It's called Munchausen syndrome, a psychological disorder where someone feigns or induces illness in themselves to gain attention and sympathy. Beverley exhibited classic symptoms throughout her adolescence and early adulthood. She became so well known among local doctors for her attention-seeking behavior that she had to start doctor hopping, moving from one medical practice to another as each physician caught on to her pattern. She also engaged in self-harm, though not in the way most people think of it. This wasn't about emotional pain or coping mechanisms. For Beverley, harming herself was about creating a narrative, about becoming the victim in a story where everyone else played supporting roles. She wanted sympathy. She wanted people to worry about her, to focus on her, to make her the center of attention. Her romantic relationships followed a similar pattern. Beverley had a boyfriend during her late teens who would later describe her as aggressive, manipulative, and deceptive. She falsely claimed to be pregnant at one point, a lie designed to keep him from leaving her. When that didn't work, she claimed she had been raped, another lie, another desperate bid for attention and sympathy. The relationship eventually ended, but the pattern was established. Beverley Allitt would do anything, say anything, hurt anyone including herself to get the attention she craved. Despite all of these red flags, despite a history that should have raised serious concerns about her psychological fitness for a caregiving role, Beverley Allitt decided she wanted to become a nurse. And somehow, against all odds and all common sense, the healthcare system let her. She enrolled in a nursing program at Grantham College. Her attendance record was abysmal. She was constantly calling in sick, claiming various illnesses and injuries that kept her out of class. She failed her nursing examinations multiple times. Her instructors had concerns about her behavior. During one placement at a nursing home, she was suspected of smearing feces on the walls, though nothing was ever proven. She was clearly not suited for the profession, clearly struggling both academically and behaviorally. But in early 1991, Grantham and Kesteven General Hospital was desperately understaffed. They needed nurses, and they needed them quickly. Beverley Allitt, despite her poor attendance record and her repeated failures, had managed to barely qualify as a state-enrolled nurse, the lowest level of nursing qualification in the UK at the time. The hospital offered her a temporary 6-month contract to work on Children's Ward 4. She accepted immediately. It was the worst hearing decision in the hospital's history. Within weeks of Beverley Allitt starting her new job, children started dying. February 21, 1991. 7-month-old Liam Taylor was a happy, healthy baby. Well, mostly healthy. He had developed a chest infection, nothing too serious, but his parents Chris and Joanne Taylor wanted to be cautious. They brought him to Grantham Hospital, where he was admitted to Children's Ward 4 for observation and treatment. It was meant to be a short stay, just a couple of days to make sure the infection didn't get worse and that little Liam was breathing comfortably. Beverley Allitt was assigned to Liam's care. She was attentive from the start, perhaps too attentive. She reassured Chris and Joanne that their son was in excellent hands. She told them they should go home and get some rest, that she would personally keep an eye on Liam throughout the night. There was something about the way she said it, something in her voice that was both comforting and unsettling at the same time, though the Taylors couldn't quite put their finger on what it was. They went home trusting that their baby boy would be safe. A few hours later, the hospital called. Liam had suffered a respiratory emergency. The Taylors rushed back to the hospital, their hearts pounding, their minds racing through every worst-case scenario. When they arrived, Beverley Allitt met them with a calm, professional demeanor. She explained that Liam had stopped breathing briefly, but that the medical team had intervened and he was stable now. Everything was fine. Crisis averted. But Chris and Joanne didn't feel fine. Something in their gut told them to stay at the hospital that night. They couldn't explain it, that parental instinct that screams at you when something is wrong with your child. So they stayed. Beverley Allitt volunteered to work an extra night shift specifically to watch over Liam. She seemed so dedicated, so caring. The Taylors felt grateful. They had no idea they were watching their son's killer in action. Just before midnight, Liam had another respiratory crisis. The medical team responded quickly and managed to stabilize him again. Everyone breathed a sigh of relief. Liam was okay. He had made it through. The Taylors, exhausted from the emotional roller coaster, finally allowed themselves to relax slightly. Liam was in good hands. The worst was over. Beverley Allitt was left alone with Liam Taylor shortly after midnight. Just her and the baby, alone in the quiet of Ward 4 while the other nurses attended to patients in different rooms. What happened in those few minutes will never be fully known. Beverley has never confessed to the specifics, never explained exactly what she did to that innocent 7-month-old baby. But we know the result. Liam's condition worsened dramatically. His skin turned deathly pale, then red blotches appeared across his face. Beverley summoned the emergency resuscitation team, her voice urgent over the intercom. The team arrived to find Liam in full cardiac arrest. They worked on him desperately, performing CPR, trying every intervention they knew. They managed to get his heart beating again, but the damage was done. Liam had been deprived of oxygen for too long. He had suffered catastrophic brain damage. The Taylors were told the unthinkable. Their baby boy was alive only because of life support machines. Without them, he would die. There was no brain activity, no chance of recovery. The doctors gently explained that the kindest thing they could do for Liam was to turn off the machines and let him go. Chris and Joanne Taylor had to make a decision no parent should ever have to make. On February 22, 1991, one day after their son was admitted to the hospital for a simple chest infection, they authorized the removal of life support. Liam Taylor died in his parents' arms. The cause of death was recorded as heart failure. Nobody questioned it. Nobody suspected foul play. Why would they? This was a hospital, a place of healing. The nurses and doctors were there to save lives, not take them. Beverley Allitt attended Liam's death with apparent sadness. She seemed genuinely affected by the loss. She even took hand and footprints of baby Liam as keepsakes for the grieving parents. Chris and Joanne Taylor went home without their son. They buried him. They grieved. They tried to understand how a chest infection could have taken their baby's life so quickly, so violently. The doctors didn't have good answers for them. Sometimes these things just happen, they were told. It was tragic, but it was natural. It wasn't natural. It was murder. Liam Taylor was Beverley Allitt's first victim, but he wouldn't be her last. In fact, her killing spree had only just begun. Barely 2 weeks after Liam Taylor's death, another child arrived at Ward 4. Timothy Hardwick was 11 years old and had cerebral palsy. On March 5, 1991, he was admitted following an epileptic seizure. It wasn't unusual for Timothy to have seizures. His condition made them relatively common, but this one had been particularly severe, and his parents wanted him to be monitored by medical professionals for a day or two. It was meant to be a precautionary admission, nothing serious, certainly nothing life-threatening. Beverley Allitt took over Timothy's care. She was alone with him when, once again, she summoned the emergency resuscitation team. They found Timothy without a pulse and turning blue. A full pediatric specialist team worked on the 11-year-old boy, performing CPR, trying to restart his heart, but nothing worked. Timothy Hardwick was dead. An autopsy was performed, but it failed to provide a clear cause of death. The doctors attributed it to his epilepsy, suggesting that perhaps the seizure had been more severe than anyone realized, that maybe his brain had sustained damage that led to cardiac arrest. It was tragic, but these things happen with severe epilepsy, don't they? Nobody questioned the fact that Timothy had been stable, that he had been recovering, that his death made absolutely no medical sense. Nobody except maybe 1 or 2 nurses who were starting to feel a creeping sense of unease. 2 children dead in 2 weeks, both under Beverley Allitt's care. It was probably just a coincidence, they told themselves. A terrible, horrible coincidence. On March 3, 1991, 1-year-old Kaylee Desmond was admitted to Ward 4 with a chest infection. She seemed to be recovering well. The doctors were pleased with her progress and were planning to discharge her within a few days. 5 days into her stay, on March 8, Kaylee went into cardiac arrest in the exact same bed where Liam Taylor had died just weeks before. Beverley Allitt was the nurse in attendance. She called for help, and the resuscitation team managed to revive little Kaylee. Because her condition was now critical, she was transferred to Queen's Medical Center in Nottingham, a larger hospital with more advanced pediatric facilities. During the examination at Queen's Medical Center, doctors discovered something odd. There was a puncture mark under Kaylee's armpit, and near that puncture mark, they found an air bubble. An air bubble in the bloodstream is incredibly dangerous. It can cause an embolism, blocking blood flow to vital organs like the heart and brain. The doctors at Queen's Medical Center noted the finding but attributed it to an accidental injection. Maybe someone at Grantham Hospital had given her medication and accidentally introduced air into the syringe. It happens, though it shouldn't. But they didn't investigate further. They treated Kaylee, and thankfully she survived. She was one of the lucky ones. 5-month-old Paul Crampton wasn't quite as lucky, though he did survive. He was admitted to Ward 4 on March 20, 1991, with a bronchial infection. Nothing serious, just a baby with a cough who needed some monitoring. He was recovering well and was about to be discharged when suddenly, out of nowhere, he went into insulin shock. His blood sugar levels plummeted. He slipped into a near coma. The medical team was baffled. Paul didn't have diabetes. There was no reason for his insulin levels to be abnormally high. They stabilized him, but then it happened again. And again. 3 separate episodes of unexplained insulin shock. Each time, the doctors managed to revive him, but they couldn't explain what was causing it. Paul was transferred to Queen's Medical Center in Nottingham for more comprehensive testing. Beverley Allitt volunteered to ride in the ambulance with him. During the ambulance ride, Paul had another episode of insulin shock. When he arrived at Queen's Medical Center, doctors ran extensive blood tests and found that his insulin levels were off the charts. Someone had injected this 5-month-old baby with insulin. But who? And why? The doctors couldn't answer those questions, but they managed to stabilize Paul and eventually he recovered. The very next day after Paul Crampton's insulin shock episodes, 5-year-old Bradley Gibson, who had been admitted with pneumonia, suddenly went into cardiac arrest. The resuscitation team saved him, but blood tests showed his insulin levels were also dangerously high. That night, Beverley Allitt visited Bradley in his room. Shortly after her visit, he had another heart attack. He was rushed to Nottingham, where he recovered. Then there was 2-year-old Yik Hung Chan, who turned blue and stopped breathing while under Beverley Allitt's care. He survived. And 2-month-old twins Katie and Becky Phillips, whose story is perhaps the most heartbreaking of all. Becky Phillips was admitted to Ward 4 on April 1, 1991 with gastroenteritis. Beverley Allitt took over her care. 2 days later, Allitt raised an alarm, claiming Becky looked hypoglycemic and felt cold to the touch. Doctors examined the baby but found nothing wrong. Becky was sent home with her mother. That night, Becky went into convulsions at home. She cried out as if in terrible pain. Her parents called a doctor, who suggested it was probably just colic. They kept her in their bed to monitor her, but during the night, baby Becky died. An autopsy was performed, but pathologists couldn't find a clear cause of death. It was labeled as unexplained, possibly natural causes related to her premature birth and recent illness. Becky's twin sister, Katie, was admitted to Ward 4 as a precautionary measure. If Becky had died from some undiagnosed condition, Katie might have it too. It made sense to keep her under observation. Unfortunately, Beverley Allitt was once again assigned to her care. Katie stopped breathing while under Allitt's watch. The resuscitation team managed to revive her, but 2 days later she collapsed again. This time, her lungs collapsed as well. The revival efforts were successful, but Katie had sustained serious injuries. 5 of her tiny ribs were broken. She had suffered severe brain damage from oxygen deprivation. Katie Phillips was transferred to Nottingham, where she survived, but the damage was permanent. She was left with partial paralysis, cerebral palsy, and significant sight and hearing impairments. Her life would never be the same. In a twist of cruel irony, Katie's mother, Sue Phillips, was so grateful to Beverley Allitt for saving her daughter's life that she asked Allitt to be Katie's godmother. Beverley accepted with apparent honor and humility. She attended christenings and sent cards. She played the role of the caring, devoted nurse to perfection, all while knowing she was the one who had destroyed that little girl's life. By April 1991, the medical staff at Grantham Hospital were terrified. Something was happening on Children's Ward 4, something they couldn't explain. The number of cardiac arrests, unexplained collapses, and sudden deaths was astronomical, way beyond anything that could be considered normal or coincidental. Dr. Nelson Porter, a consultant at the hospital, couldn't sleep at night. He kept running the numbers through his head, kept trying to find a pattern, a medical explanation for what was happening. Was there a virus? Some kind of bacterial infection spreading through the ward? Was the ventilation system contaminated? Were the medications mislabeled? He explored every possibility, every rational explanation. Nurses whispered to each other in the break room, afraid to voice their suspicions out loud. They had all noticed that Beverley Allitt seemed to be present for every single incident. Every child who collapsed, every unexplained cardiac arrest, every mysterious illness, Beverley was there. But accusing a fellow nurse of harming children was unthinkable. It was the kind of accusation that could ruin a career, that could lead to lawsuits, that could destroy lives. They needed to be absolutely certain before saying anything. The nursing staff at Queen's Medical Center in Nottingham were also starting to notice something strange. Grantham Hospital was sending them an unusual number of critically ill children, many of whom had inexplicably high insulin levels or other bizarre symptoms that didn't match their initial diagnoses. Professor David Hull, a respected pediatrician at Queen's Medical Center, raised concerns with Grantham Hospital. What was going on in Ward 4? Why were so many children suddenly experiencing life-threatening complications from routine illnesses? But it wasn't until April 22, 1991, when 15-month-old Claire Peck died, that someone finally said enough was enough. Dr. Nelson Porter initiated a formal inquiry. He couldn't ignore it anymore. The statistics were damning. In just 59 days, there had been 25 suspicious incidents involving 13 children. 4 were dead. 9 others had been harmed. This wasn't natural. This wasn't coincidence. Something criminal was happening on Ward 4. The initial suspicion was some kind of airborne pathogen or environmental contamination. Tests were run on the air quality, the water supply, the ventilation systems. Everything came back normal. Then they tested Claire Peck's blood and found something that made their blood run cold. Her potassium levels were through the roof, far higher than anything natural, and there were traces of lignocaine in her system, a drug used during cardiac arrest but never administered to infants. On April 30, 1991, 8 days after Claire Peck's death, the police were called. Detective Superintendent Stuart Clifton was assigned to lead what would become one of the most complex and disturbing investigations in British criminal history. When he first arrived at Grantham Hospital and was briefed on the situation, he knew immediately that they were dealing with something extraordinary. This wasn't a case of medical malpractice or accidental contamination. This was deliberate. This was murder. The police began reviewing every suspicious incident that had occurred on Ward 4 over the previous 3 months. They interviewed doctors, nurses, and parents. They collected medical records, shift schedules, and security logs. They exhumed bodies and performed new autopsies using more advanced toxicology testing. What they discovered was horrifying. In multiple victims, they found extraordinarily high levels of insulin, far beyond anything that could occur naturally. In others, they found evidence of air embolisms, tiny bubbles injected directly into the bloodstream that would cause cardiac arrest. Some children showed signs of suffocation or oxygen deprivation. The methods varied, but the result was always the same: sudden, life-threatening medical crises that made no sense given the children's initial conditions. Then the investigators did something that would prove crucial. They created a timeline. They mapped out every single suspicious incident, every cardiac arrest, every unexplained collapse, every death. And then they overlaid the staff shift schedules on top of that timeline. One name appeared at every single incident. Beverley Allitt had been on duty for all 25 suspicious episodes. Not most of them, not even just the majority, all of them, every single one. The statistical probability of that being a coincidence was essentially zero. On April 30, 1991, Beverley Allitt was suspended from her position at Grantham Hospital pending the investigation. You would think that being suspended from a job because police suspect you of murdering children would cause most people to lay low, to perhaps reflect on their actions, to at least pretend to be concerned. But not Beverley Allitt. Within days of her suspension, she was applying for nursing jobs at other hospitals. She actively sought positions working with children, with vulnerable patients, with exactly the kind of victims she had been targeting. It was breathtaking in its audacity and its danger. If the investigation hadn't moved as quickly as it did, if those hospitals had hired her before the police finished gathering evidence, there could have been more victims. The investigation continued for months. Police discovered that nursing logs from Ward 4 were missing, specifically logs from the days when Paul Crampton had been experiencing his mysterious insulin shock episodes. They searched Beverley Allitt's home and found torn pages from those missing logs hidden in her belongings. The evidence was mounting, but Allitt remained calm and composed during police interviews. She denied everything. She insisted she had simply been doing her job, caring for sick children to the best of her ability. If they had died or been harmed, it was because they were already ill. She was just the unfortunate nurse who happened to be there when tragedy struck. It was bad luck, nothing more. But the police knew better. The forensic evidence was damning. The statistical evidence was impossible to ignore. And then there was Beverley's own psychological history, which painted a picture of someone who craved attention and would go to extraordinary lengths to get it. Psychiatrists who evaluated Beverley Allitt identified her as suffering from both Munchausen syndrome and Munchausen syndrome by proxy. Munchausen syndrome is when someone fakes or induces illness in themselves to gain attention. Munchausen syndrome by proxy is when someone harms another person, usually someone in their care, to gain attention and sympathy. It's exceedingly rare for someone to suffer from both conditions simultaneously, but Beverley Allitt exhibited clear symptoms of both. Her entire life had been about getting attention through illness and injury. When faking her own illnesses stopped generating the desired level of sympathy and concern, she escalated. She began harming the children in her care, creating medical emergencies that would make her the center of attention. She could play the heroic nurse trying to save lives. She could comfort grieving parents. She could be the person everyone turned to in a crisis. The children were just props in her twisted performance, expendable extras in a drama where she was always the star. On November 20, 1991, Beverley Gail Allitt was formally arrested and charged with 4 counts of murder, 11 counts of attempted murder, and 11 counts of causing grievous bodily harm. She was 23 years old. The trial of Beverley Allitt began on February 15, 1993, at Nottingham Crown Court. It was supposed to start much earlier, but Beverley's attention-seeking behavior delayed it for months. She claimed to be suffering from various illnesses. She lost 5 stone in weight, developing anorexia nervosa. She was hospitalized multiple times. The prosecution argued that this was simply more of the same behavior she had exhibited her entire life, using illness to manipulate people and situations to her advantage. When the trial finally began, it quickly became clear that this was going to be one of the most emotionally devastating cases in British legal history. The courtroom was packed with journalists, legal professionals, and members of the public desperate to understand how something so evil could happen. The prosecution laid out their case methodically. They presented the timeline showing Beverley Allitt's presence at every single suspicious incident. They brought in medical experts who testified about the insulin found in the victim's blood, the air embolisms, the evidence of suffocation and oxygen deprivation. They presented the torn nursing logs found in Allitt's home. They showed the jury photographs of the victims, tiny bobbies and young children whose lives had been cut short or permanently damaged. Parents took the stand, many of them breaking down as they described watching their children die, trusting that the nurses were doing everything possible to save them, never imagining that one of those nurses was the cause of their child's suffering. Sue Phillips, mother of twins Katie and Becky, testified about losing one daughter and watching the other suffer permanent disabilities, all while Beverley Allitt played the role of caring godmother. Professor Roy Meadow, a renowned pediatrician and expert on Munchausen syndrome by proxy, testified about Beverley's psychological condition. He explained to the jury how someone with this disorder views their victims not as people, but as tools to generate attention and sympathy. He described Beverley's pattern of behavior dating back to childhood and explained how it had escalated to murder. In his expert opinion, Beverley Allitt would never be cured. She was a permanent danger to anyone in her care. The defense had little to work with. They couldn't deny that Beverley had been present for every incident. They couldn't explain away the forensic evidence. Their strategy seemed to be suggesting that perhaps the deaths and injuries were coincidental, that maybe Beverley was just unlucky, that correlation doesn't equal causation. It was a weak defense, and everyone in the courtroom knew it. Beverley Allitt herself was only present for 16 days of the 2-month trial. She claimed to be too ill to attend, continuing her pattern of using sickness as a form of manipulation and control. On the days she did appear, she showed little emotion. She didn't cry when parents described their grief. She didn't flinch when medical experts described how the children had suffered. She sat quietly, almost serenely, as if the trial was happening to someone else. On May 23, 1993, after weeks of testimony and evidence, the jury returned their verdict. Guilty on all counts. 4 counts of murder, 11 counts of attempted murder, 11 counts of causing grievous bodily harm. Beverley Gale Allitt was convicted on every single charge. Justice David Latham, the presiding judge, handed down the sentence. 13 concurrent life sentences. It was the harshest sentence ever given to a female criminal in British history up to that point. Justice Latham told Allitt directly that she was a serious danger to others and would likely never be safe to release into society. He spoke of the unimaginable suffering of the victims and their families. He spoke of the trust that had been betrayed, the profession of nursing that had been brought into disgrace. And then he sent her away to spend the rest of her life in prison. Except she didn't go to prison, not exactly. After just 1 week in a standard prison, Beverley Allitt claimed she couldn't eat or drink. She was transferred to Crampton Secure Hospital, a high-security psychiatric facility in Nottinghamshire. Crampton is where Britain's most dangerous psychiatric patients are held, people deemed too mentally ill for prison but too dangerous for regular psychiatric hospitals. Once at Crampton, Beverley's attention-seeking behavior continued exactly as the experts had predicted. She ingested ground glass. She poured boiling water on her own hand. She self-harmed in ways designed to generate concern and attention from the medical staff. Some experts have argued that Beverley Allitt is not genuinely mentally ill and should be in a regular prison, not a secure hospital. Forensic psychiatrist Jeremy Coyd and criminologist Elizabeth Yardley both examined her and concluded she was manipulating the system, using her knowledge of psychological disorders to avoid prison. The conditions at Crampton are significantly more comfortable than a standard prison. The facility has about 1,400 staff members to care for roughly 400 inmates. It costs taxpayers around £2,000 per week, per inmate, to operate. Chris Taylor, father of Beverley's first victim Liam, has been particularly vocal in his criticism of Allitt's placement at Crampton. He described it as more like a holiday camp than a punishment, and many people agree with him. Over the years, there have been various controversies surrounding Beverley Allitt's incarceration. In 2001, there were reports she planned to marry a fellow Crampton inmate named Mark Heggie, though this never actually happened. In 2005, it was revealed that Allitt had received over £25,000 in state benefits since her incarceration, money she was technically entitled to, but which seemed deeply unfair to the families of her victims. In 2006, Allitt applied for a review of her sentence, which required the probation service to contact victims' families. The families were horrified at the prospect of her being released. The review process dragged on for years. Her original minimum tariff of 30 years expired in November 2021, making her eligible for parole. In 2023, she appeared before a mental health tribunal seeking transfer to a mainstream prison, which would expedite her parole eligibility. Thankfully, that request was denied in December 2023. She won't be eligible for another assessment until 2026 at the earliest. The impact of Beverley Allitt's crimes extended far beyond her victims and their families. The entire nursing profession in Britain was rocked by the scandal. How had someone with such obvious psychological problems been allowed to become a nurse? How had she been hired despite her poor attendance record and repeated failures? How had the warning signs been missed? In May 1993, immediately after Allitt's conviction, an independent inquiry was launched under Sir Cecil Clothier. The Clothier inquiry examined every aspect of how Beverley Allitt had been able to commit her crimes undetected and how she had been hired in the first place. The findings were damning. The inquiry revealed that there had been no proper background checks. Allitt's history of psychological problems, her pattern of attention-seeking through illness, her poor performance in nursing school, none of it had been adequately investigated before she was hired. The hospital had been so desperate for staff that they had essentially taken her at face value. Furthermore, when concerns were raised during her employment, when nurses started noticing the pattern of incidents whenever Allitt was on duty, those concerns were ignored or dismissed. Hospital management didn't want to believe that a nurse could be harming patients. They looked for other explanations, any other explanation, rather than facing the horrifying truth. The Clothier inquiry made numerous recommendations for improving NHS hearing practices, background checks, and protocols for investigating suspicious incidents on hospital wards. Many of these recommendations were implemented, but as the recent case of Lucy Letby has shown, the lessons of Beverley Allitt were not fully learned. In 2023, Lucy Letby, another British nurse, was convicted of murdering 7 bobbies and attempting to murder 6 more at a hospital in Chester. The parallels to the Beverley Allitt case are chilling and heartbreaking. It's important, essential really, to remember that behind all the legal proceedings and psychological analysis and systemic failures, there are real victims, real children whose lives were stolen or irreparably damaged, real families who will never recover from what Beverley Allitt did to them. Liam Taylor would be 35 years old today if he had lived. His parents, Chris and Joanne, have spent over 3 decades grieving their son and fighting to ensure Beverley Allitt never walks free. They've had to relive their trauma every time she applies for parole, every time there's a news story about her seeking better conditions or transfer to a different facility. Their pain has never ended. Timothy Hardwick was only 11 years old when Beverley Allitt killed him. He had cerebral palsy, a condition that made his life challenging, but his family loved him dearly. He deserved to grow up, to experience life, to be more than just another name on a serial killer's victim list. Becky Phillips never got to grow up alongside her twin sister Katie. Katie survived but was left with devastating injuries, partial paralysis, cerebral palsy, significant vision and hearing impairments. She has required constant care throughout her life. Her mother, Sue, has had to live with the knowledge that she asked her daughter's attacker to be the child's godmother, never knowing the truth until it was far too late. The guilt, even though it's completely unwarranted, must be unbearable. Claire Peck was 15 months old when she died. She was just a baby with asthma who needed a little help breathing. She should have gone home to her parents after a day or two. Instead, she became Beverley Allitt's final victim, the death that finally triggered the investigation that brought the killing spree to an end. And then there are the survivors, children like Kaylee Desmond, Paul Crampton, Bradley Gibson, and Yik Hung Chan. They lived, but they all suffered. They all experienced cardiac arrests, insulin shock, oxygen deprivation. The long-term effects of these attacks are difficult to quantify, but there's no doubt they left scars both physical and psychological. The community of Grantham was traumatized. Parents who had taken their children to the hospital for routine care, trusting that they would be safe, were left questioning everything. The hospital itself never fully recovered. The maternity unit at Grantham and Kesteven General Hospital was eventually closed down altogether, a direct result of the loss of public trust following the Beverley Allitt scandal. One of the most common questions people ask about Beverley Allitt is simply, why? Why would someone become a nurse, a profession dedicated to healing and caring, only to use that position to harm the most vulnerable patients imaginable? Why would someone murder babies? The clinical answer involves Munchausen syndrome by proxy, a psychological disorder that's difficult for most people to comprehend. People with this condition harm others, usually children in their care, to generate attention and sympathy for themselves. It's not about the victims. The victims are simply means to an end. They're tools used to create drama, to become the center of attention, to play the role of the heroic caregiver battling to save lives. Beverley Allitt exhibited this pattern from childhood, but it escalated dramatically when she became a nurse. Suddenly, she had access to vulnerable children, to medications and equipment that could cause harm, and to a position of trust that meant no one would suspect her. When a child under her care went into cardiac arrest, she could call for help and watch as the entire hospital mobilized around her. She was the one who had been there. She was the one who raised the alarm. She was the one comforting the parents. Everything revolved around her. And when the child died, she got even more attention. She could comfort the grieving parents, take hand and footprints as keepsakes, attend funerals, send sympathy cards. She became part of the family's tragedy, a supporting character in their story of loss. For someone with Munchausen syndrome by proxy, this attention is like a drug. It's never enough. They always need more. But understanding the psychological mechanism doesn't really answer the question, does it? It doesn't explain how someone can look at a tiny baby, a 7-month-old infant who smiles when you walk into the room, and decide to murder that child just to get attention. It doesn't explain how someone can inject air into a toddler's bloodstream and watch them suffer. It doesn't explain how someone can harm 13 children, killing 4 of them, and show no remorse. The truth is, some acts are simply beyond comprehension. Some people are broken in ways that can't be fixed, damaged in ways that make them fundamentally dangerous to society. Beverley Allitt is one of those people. Whether she's in a secure hospital or a prison, whether she's genuinely mentally ill or manipulating the system, the end result is the same. She can never be allowed near vulnerable people again. The risk is simply too great. The Clothier Inquiry made dozens of recommendations designed to prevent another Beverley Allitt. Better background checks, more rigorous psychological screening, protocols for investigating unusual patterns of patient deaths or injuries, whistleblower protections for medical staff who raise concerns. Many of these recommendations were implemented throughout the NHS. But in 2023, 30 years after Beverley Allitt's conviction, Lucy Letby was found guilty of murdering 7 babies and attempting to murder 6 others at the Countess of Chester Hospital. The patterns were eerily similar. A young nurse present for every suspicious incident. Hospital management ignoring or dismissing concerns raised by doctors. A reluctance to believe that someone in a caring profession could be causing harm. It was Beverley Allitt all over again. The Lucy Letby case has reignited debates about how hospitals handle suspicions of criminal activity among staff, how background checks are conducted, and how whistleblowers are protected. It's raised uncomfortable questions about whether the lessons of Beverley Allitt were truly learned, or if they were just given lip service before being forgotten. Healthcare serial killers are thankfully extremely rare. The vast majority of nurses and doctors are dedicated professionals who genuinely care about their patients, but the few who do exist can cause unimaginable harm precisely because they operate in an environment of trust. Patients and families are vulnerable. They're scared and sick and desperate for help. The last thing they're thinking is that the person in the uniform might be the one they need protection from. Vigilance is essential. Statistical monitoring of patient outcomes by individual healthcare workers can catch unusual patterns early. A culture that takes concerns seriously and investigates them thoroughly can save lives. And perhaps most importantly, rigorous background checks and psychological screening can keep people like Beverley Allitt out of healthcare in the first place. Beverley Allitt should never have been hired as a nurse. Her history should have disqualified her. But desperation for staff, inadequate vetting procedures, and a reluctance to believe the worst about people combined to put her in a position where she had access to vulnerable children. And 13 children paid the price for those failures. The families of Beverley Allitt's victims have spent decades fighting to ensure she never walks free, that justice continues to be served, that their children are not forgotten. They've had to watch as she's been housed in relative comfort at Crampton. They've had to endure parole hearings and appeals and media coverage that dredges up their worst memories. Their suffering continues while Beverley Allitt lives out her life with 3 meals a day, medical care, and protection from the consequences of her actions. As of January 2026, Beverley Allitt remains detained at Crampton Secure Hospital. She is 57 years old. She has spent more than half her life incarcerated, and if the legal system works as it should, she will die there. Her minimum tariff has expired, but every parole board that has reviewed her case has concluded the same thing. She remains a danger. She cannot be trusted. She cannot be released. The angel of death will never fly free again. This case reminds us that evil doesn't always announce itself with fanfare. Sometimes it wears a nurse's uniform and speaks in soothing tones. Sometimes it reassures worried parents and volunteers for extra shifts. Sometimes it hides behind a smile and a caring demeanor. But evil is still evil, no matter how well it's disguised. The children Beverley Allitt harmed deserved better. They deserve to grow up. They deserve to live full lives. They deserve to be more than statistics in a criminal case, more than names on a list of victims. Liam Taylor, Timothy Hardwick, Kaylee Desmond, Paul Crampton, Bradley Gibson, Yik-Hung Chan, Becky Phillips, Katie Phillips, Claire Peck, and the others whose names have been kept private to protect their families. We remember them. We honor them by learning from what happened to them, by demanding better from our healthcare systems, by never forgetting that vigilance and accountability can save lives. And we remember that trust, while essential, must always be paired with verification. The systems must be in place to catch those who would abuse that trust. Because the children in our hospitals, the most vulnerable members of our society, deserve nothing less than our absolute commitment to their safety. If this case has affected you, or if you have concerns about care you or a loved one has received in a medical setting, please don't hesitate to speak up. Trust your instincts. Ask questions. Demand answers. The medical professionals who genuinely care about their patients will welcome your involvement and address your concerns. And the ones who don't, well, they're the ones we need to be watching. Thank you for listening to this story. It's not an easy one to hear, and it wasn't easy to tell. But these stories matter. These victims matter. And remembering them, learning from what happened to them, that's how we honor their memory and work to prevent it from happening again.